These 9 medications do not cause rapid onset dementia, okay? That is just a sensational headline, not the real data. So let's dig into it, right? So first, let's start off with some vocabulary. The drugs most commonly referred to are called anticholinergics, okay? Anti means against, and cholinergic is a brain chemical, acetylcholine, that's used for memory and thinking, right? So anticholinergic means something that blocks memory and thinking, brain chemical for that, right? Medications in this class are things like Benadryl, you've heard of that, bladder control medications like oxybutynin, some antidepressants, amitriptyline, for example, and some anti-nausea medications like promethazine. There are many, many, many more, right? You're taking one of these for a few days, it can cause temporary confusion, especially in elderly patients, right? And that data is well established. But that temporary confusion is called delirium. It has a name. Delirium, memory loss, and dementia are 3 completely different things, right? They all get lumped in together constantly, but that is not how they should be treated, okay? So let's break it down. Delirium, which is what I just mentioned, has a sudden onset, hours to days. It's usually tied to a clear cause, things like a medication that's new, infection, or a hospital stay, right? The cause is often reversible, and once that cause is reversed, we consider that delirium treated, right? Memory loss, number 2, is a symptom, okay? It's not a diagnosis. Memory loss can come from stress, poor sleep, or a side effect from a medication. Now, dementia, number 3, is different again. It's gradual, progressive. It does not reverse. Confusing the 3 is a big part of why headlines like the one I mentioned earlier today catch a lot of traction. Now, the real question is, does taking these medications I mentioned earlier, taking them for years, does it raise your risk of dementia down the road? Question mark. The data is unclear, unfortunately, right? So a lot of these drugs are in something called the Beers criteria. Beer, like the word beer, you would drink, right? It's a list that doctors and pharmacists use to flag medications that may have more risk than benefit in the elderly population. The Beers criteria is an actual clinical tool we use. It's not a trending theory, okay? Now, here's what the headlines leave out. It's about years of accumulated use, not about one dose. Nothing gets suddenly triggered with dementia, okay? What there is genuinely mixed evidence when it comes to dementia. So let's break down a couple things. One study followed people for 8 years, which is a good amount of time, right? And they found that these drugs I mentioned earlier can cause memory decline that did not turn into higher dementia rates, right? Another study found the opposite of that. So again, it's unsettled. And every one of these studies always show association and not proof, right? They find these things are found together. They don't necessarily cause each other. Researchers found people who took these drugs long-term were more likely to develop dementia. That's different from proving the drug caused dementia. No study has shown that. So what is the real risk? There's a study from 2018 published by the BMJ, one of the largest of its kind. It had 40,000 participants in it with patients with dementia. The study measured cumulative dose, basically how much of the drug added up over years of use, not just whether the drug was taken. And the strongest risk signal showed up in people with the equivalent dose of about 3 years of daily use, right? So that's what they were able to prove. So for someone in their late 60s on one of these medications long-term, their 15-year dementia risk went from being 10% to being 12%. That's what the medication added, that 2 extra percent of risk of developing dementia in 15 years. In plain numbers, 1 out of 50 people taking one of these medications long-term, 1 extra person developed dementia that otherwise would not have. That means 49 of those people, there was no difference in them, right? And those are real numbers, right? They're worth knowing. It's also nowhere close to this trend of rapid dementia, okay? So don't panic, don't stop taking your prescription medications without talking to your healthcare provider because of some trending video, okay? And do ask your pharmacist, am I on Beers criteria, or is my medication on a Beers list? And what is my long-term risk, okay? Have a great day, everybody. Hope you learned something today.